Dr. Sharifah obtains a medical degree in medicine from University Kebangsaan Malaysia in 1991. She later specialized in the field of obstetrics and gynecology. Dr. Sharifah has a vast working experience in the field of obstetrics and gynecology at government hospital and as well as a private hospital. Currently, Dr. Sharifah is a senior consultant obstetrician and gynecologist at the private practice hospital in Johor. She has done more than 5,000 cesarean sections, gynecology surgery of various indications conventionally and laparoscopically throughout her practice. Dr. Sharifah is also a researcher, contribute high-quality medical scientific reviews to Cochrane and published many articles related to women's health in the Health magazine and newspaper nationwide. Dr. Sharifah's special interest is in the management of menstrual and hormonal disorder, which include polycystic ovarian syndrome, uterine fibroid, endometriosis, and fertility treatment. She has a specialty in laparoscopic gynecological surgery as well as aesthetic gynecology. No more further delay, I shall pass the session to Dr. Sharifah for her sharing.
Thank you, Shireen. That very lengthy introduction. Today first of all, I privileged to come tonight before you all of you women out there, to share information or knowledge about menstruation. Menstruation, especially in women after 40 years old. Can we share the screen?
Yeah, you can share the slide now.
So I put the host disabled participant videos.
Oh, okay. Okay, now you can do it. Okay, yeah, you can see it. You can put slideshow. Yeah.
Okay.
Okay.
Yeah. So that is our talk today. We're going to go through with all of you. Of course, in between, if I am not very clear or you want to ask some clarification, please send a message inbox so that we can look into it and answer your question tonight. Okay, we are today. The topic is about heavy menstruation after 40, the cause and treatment. Yeah, when we say heavy menstruations, in medical terms, we call it menorrhagia. So I'm sure when you see a doctor, you come across to this term. Sometimes your doctor, tend to be a little bit more scientific with you. So they call it menorrhagia. So it means it is a heavy menstrual bleeding. It can be also intermenstrual bleeding that exceed the normal period. The normal period. I will let you know how much normal period is supposed to be. So when we're talking about heavy menstrual bleeding, abnormal uterine bleeding after 40, it can come in the form of heavy menstrual bleeding. It can also come in the form of intermenstrual bleeding, or it can also come in the form of irregular menstrual bleeding, which is all these are very common in women after 40. After 40, women can be classified as in the category of perimenopausal. I mean, they're not menopause yet, but they are going to that direction 5 to 10 years ahead. So when you have menorrhagia means heavy period, but it is regular, cyclical, mean that it's regular period, but it's very, very heavy. Last time we call it dysfunctional uterine bleeding, but nowadays this term has been discarded. We call it heavy menstrual bleeding. Okay, there are many causes. What are the causes of heavy menstrual bleeding in women after 40 or women in the perimenopausal period? So one of the common causes, I mean, these are the common causes of heavy menstrual bleeding in women after 40. Yeah? One of it is polyps. It can be cervical polyp, or it can also be endometrial polyps. It means the growth which is benign, that coming out, protruded out from the cervix and also in the uterus. It can also due to adenomyosis or kind of variant of endometriosis. This is usually very heavy bleeding, very common in women after 40, and very painful as well. The third one is can be cause of fibroid. Fibroid and adenomyosis, they are different, but they actually is a tumor of the uterus, a benign tumor. They are not cancer, not cancerous, benign tumor, but they can give problems to women after 40, especially and most commonly is a very heavy uterine bleeding. Of course, any women after 40, one thing that we need to be worried is a malignancy. We have to rule out malignancy or pre-malignant condition. So that's why women who bleeding or who have heavy vaginal bleeding or abnormal uterine bleeding or any kind of abnormal menstruation, they need to go for a thorough investigation to rule out if they have malignancy or pre-malignant condition. There are also some other causes which is not related to the uterus. This is related to the uterus, to the cervix, I mean the reproductive organ. But this is something not related, which is very hormonal, like ovulatory dysfunction. It means something to do with the hormonal. You know, as we go into 40s to 50 to menopause, our ovary produce less egg, so less ovum, so less hormonal production that it's supposed to maintain the reproductive system. So sometimes, most of the time, the women will have abnormal uterine bleeding. It can be heavy bleeding, can be irregular bleeding, you know, just before their menopause. So sometimes can be due to blood disorder, coagulopathy, due to blood problem, yeah, this can happen, or endometrial kind of a condition which is also hormonal, or iatrogenic, or can be due to injury, or can be due to foreign body, maybe the IUCD that has been left in the uterus for a long time, and so on. And sometimes there's also cause something not classified, that's something that we don't know sometimes, there's no cause. There's also caused by medication. Some women, they are on medication, of this medication, for example, tamoxifen. Women who has a breast cancer, very commonly, yeah, before the menopause, women who has breast cancer at the age before menopause, very common, they are on given tamoxifen to reduce risk of breast cancer recurrence. So, but tamoxifen, you know, can go back to the uterus and cause abnormal uterine bleeding. So very common, we see in my clinic that a patient on tamoxifen has endometrial polyp or sometimes bleeding from the uterus. So if they also sometimes they're on all these drug, anticoagulant drug, antidepressant, even some people on still on hormonal contraceptive, and sometimes people always on herbs, you know, herbs, ginseng and all these things sometimes can cause alteration of coagulation in the blood, so can also cause vaginal bleeding. So all these have to be ruled out. So what is a complication? Why are we worried about heavy menstruation? Okay, before that, when you say heavy, how heavy? Because some people perceive heavy, maybe you're heavy, what we think heavy, that is for you, is not heavy because you're so used to that amount of blood flow. So some people, they think that is normal. So when you bleed more than 80 ml a day, yeah, 80 ml during your menstrual period. 80 ml actually, how much is that? How many spoons is that? 80 ml we consider like maybe 2 pack. So if you bleed more than that, that's considered heavy menstruation. Or when you have period and you pass out a lot of blood clot, so that is a sign of heavy period. Or sometimes when you have flooding. Flooding means that you stand up, suddenly you got a gush of blood coming out from the vagina. That is flooding, and then go down to the floor. So that's called flooding. So these are all signs of a heavy menstruation. Your doctor, when you go to see the doctor will ask you all these signs. When they say you're having heavy bleeding, the doctor will ask you, you have clots? We have flooding, how many pad you use. So you must use this kind of measurement so that the doctor have the idea whether you have heavy menstruation or not. So what is the complication of it? Complication of it is that you lost your blood. You lost your blood volume from your body, and you lose more than what you should. Because what you take every day, you cannot keep up to what you lost from the vagina, from the uterus. So you end up with a chronic iron deficiency. You lost the iron. Okay, so you become pale over the time. So because of that, what happens is that you will have a shortness of breath. So when hemoglobin drop to below 8, normal hemoglobin is around what, 11, above 11, but then if my hemoglobin drop below 10, some people feel nothing, but some people have symptoms. But some people take lower, some people take 6, 4 to have a symptom. But most people will have shortness of breath, I mean they cannot breathe when as they walk or they climb the stairs. Suddenly they feel very difficult to breathing. They feel very tired easily. And then they feel their heart palpitation, the heart is beating very fast. And they feel very tired. See, if you have a daughter, you have a children, yeah? I mean, if you have a young daughter, they're always sleepy, young school, so sometimes you must check the hemoglobin. Maybe they're having a heavy menstruation, yeah, okay? So or they're having anemia, no enough blood due to blood loss from the menstruation. So tiredness and fatigue. So if you feel that way, better check your hemoglobin. And sometimes they also have a frequent blackout. So that also due to low hemoglobin, poor work performance. Because of that feeling tired, so their mental capacity also poor, unable to absorb memory, to memorize things. Yeah, okay. So these are all signs and the complication of heavy menstruation that causing chronic iron deficiency, which shouldn't be. Number one cause of women, if you have anemia, number one cause is heavy menstruation. That's number one cause. So if you're not treated, if this anemia become more severe, so we can also end up with a heart failure. Yeah, can have heart failure, and then it's dangerous. It can be also irreversible. Okay, what's the cause just now? So this I just show you. Don't be afraid of I'm sorry if you look at, if you haven't got a dinner. So, but I just want to show you how it look like. This is a polyp coming from the uterus. See this uterus that we have removed, and this is a polyp. See the small thing like that, also can cause bleeding very heavy. Okay, this is a cervical polyps. So look at here. This is a cervix from vagina. Cervix, you see that? This one is a endocervical polyp. Sorry. This is a ultramyoma, yeah, fibroid, that's what we call it, fibroid or myoma. So this is a cervical fibroid. Example. So this I have this lady also in the age of 42, 42. She comes with severe bleeding, pouring, flooding, yeah, until she fainting. So so when we do examination, we put the speculum, we see this very big thing in the vagina like that. So huge in the vagina. So that's why it's so heavy. So, and then she need blood transfusion, so we have to remove the whole uterus because we never know this can be a cancer as well. So this is a submucous fibroid. See, this is the uterus. This is outside, and this is inside. Look at that. This is when we remove the uterus and we open up. So this is a submucous fibroid, and this usually this kind of submucous fibroid will bleed very heavy. So, and this is another example. The cause just now, it can be a bra cancer. So this bra cancer, yeah, high endometrial hyperplasia. See, when we do operation, we cut the uterus. So you see this, this kind of portion. Look at the empty abnormal like this. So this is endometrial hyperplasia. It hasn't become cancer yet, but if you wait longer, they will go deeper inside and become a cancer. This is a cancer. Look at that, uterine sarcoma. From the fibroid, we keep long term. There's a chance of it turn cancer, but very low. What can happen? So this is one of the examples. So they are all present with the heavy menstruation after 40. Most of the patients, they are all after 40. See, look at that. If some people keep their fibroid, the uterus so big until we have to do the open surgery. This one is a very big fibroid again. Yeah. So these are all common. These are common in my practice. We see them, see, look at that. It's a huge fibroid. It's all after 40. People keep the uterus until such a big time, like this, big size like this. Only then they want to do something. This one is too late already, see, become a cancer already. All right, so uterine adenomyosis is kind of same like fibroid, but it is thickening of the wall of uterus. So usually this kind of condition will cause heavy period and very, very painful because the woman also bleeding inside this wall. So it's very painful. All right, so that just to give you a little bit of excitement to see those medical pictures. Yeah, that's how things look like. It can be look very scary. Yeah, okay. Yeah, so how do we make diagnosis? I mean, when you have uterine or abnormal uterine bleeding or heavy menstruation, okay, when you see a doctor, so what your doctor will do, the doctor will take history from you. They ask you, okay, first, how's your bleeding, how heavy is your bleeding just now. They want to establish whether your bleeding is heavy or not. Doctors want to establish whether you have anemia or not, by asking you question, whether you have a decreased effort tolerance, whether you have palpitation, and so on. And then after that, they will do physical examination. After that, the doctor will do the laboratory test and also do the imaging. Yeah, okay. So these are something. And then they will try to assess the blood loss. Just now I mentioned to you, they ask by asking you, okay, all those questions. So by your answer, the doctor will know whether you really have a heavy bleeding or not. And then after that, the doctor will do comprehensive examination. We have to evaluate. When you have uterine bleeding after 40, first thing we want to exclude is a cancer. Okay, so that's why we have to do examination. We cannot assume that, oh, maybe you have this, or perhaps you have hormone problem. We cannot assume. We must be very sure. This is just to show you that this is long time ago, when before the modern medicine. So this is how the doctor, those ancient doctor, very handsome looking, handsome doctor. So when women come with the bleeding, this is how they do examination. Okay, but nowadays we don't need to do like this. We can do a proper examination in the clinic. So we have to evaluate the uterus. We have to evaluate the endometrium, yeah, and then see whether is there any other cause that can be treated, yeah. Okay, so these are all investigation, the list of investigation that will be done, yeah, including the blood test, and then they'll do pap smear, and do ultrasound, they will do the biopsy, and biopsy, and then it depends on what we find on the ultrasound, and then after that we will recommend the treatment. Okay, so very common, that, when you're after 40, when we do ultrasound, in the gynae clinic, we call it transvaginal ultrasound. This is ultrasound that which is done through the vagina. Because when we do ultrasound to the vagina, we can see the uterus like that, very, very clear uterus. So we can see inside the cavity very clear. We can see is there any polyps. So from the abdomen, if you put the probe on top of the abdomen wall, sometimes if the uterus is not big, we cannot see very clear. So diagnosis sometimes can be very vague, or perhaps we cannot be sure about the diagnosis. So we do transvaginal scan. So when we do transvaginal ultrasound, we can see, look at that. You see, we can see polyps like that. It's so clear. Okay, when we do, so we can see what exactly can you make diagnosis there. It's just that we need to do confirmation by hysteroscopy, but we can do a very, diagnosis with a high predictive value. So like that, so see, this is also another ultrasound of a endometrial hyperplasia. See, you see something like this. See, this is uterus, and you see something thicker like that. Okay, this is inside. See, and then they have all these black cystic structures. So this is a possible endometrial hyperplasia. This is how it look like. Okay, and see, look at this. You see, when we do ultrasound, look at that. This is also endometrial hyperplasia. Look at it, so thick, the endometrium. Normal endometrium usually is around what for women after 40, maybe around 1.2 millimeter, 1.2 centimeter only. But look at this one, it's almost 5 centimeter. Look at that, it's so thick from here to here. So thick, almost 5 centimeter. And this is endometrial hyperplasia. I had one patient like this the last 2 weeks. We have, we always thought that she having a cancer. Thank God it is not. We managed to remove the uterus, and the result come back, it is endometrial hyperplasia. And this is a polyp. Look at that here. This is a uterus, and then this is a polyps, you know. So this is how it looks so clear when we do vaginal examination, transvaginal examination. Okay, then so if the doctor see the endometrium is, from the ultrasound, they see the endometrium is more than 1 centimeter, or some people take 0.5 from postmenopausal, for perimenopausal maybe 1 centimeter is appropriate. So if it is more than that, then doctor want to do assessment of your endometrium. So they call it endometrial assessment. So that depends also if you have risk factor. Example, if you have if the woman, actually they're after 45 years old, they're obese, okay, and they have history of diabetes, a family history of cancer, or they're on tamoxifen and so on, and endometrium thickness more than 12 millimeter. Okay, so then we will ask for the endometrial assessment, which is, we have to take a sample in the uterus, mean that we have to put some kind of sucker to take a wall here, equipment to take the wall here to send to the lab and see whether this is called endometrial hyperplasia or not. But this is the old way. And this using DNC. Long time ago, we used this method. We call it, in the Malay term, they say cuci rahim. Many until today also, women, if they have period, very, hair wire, take medicine also doesn't cure and still having bleeding. And many they come to the clinic, they will tell, doctor, can you cuci my rahim? So cuci. So this is called cuci rahim, dilatation and curettage. So long time ago, this is the way people do the sampling. And then at the same time treat the condition. If it is sometimes they do curettage, they scrape the wall here a lot, so the patient will become better, over a short period of time. So this is called DNC. But nowadays, this DNC is not because we already have a better medical advancement. So instead of doing a blind procedure, just putting something that we do not know where we put in the uterus. So now we have hysteroscopy. Hysteroscopy is the gold standard where we put the camera inside. So you put your eye, we put our eye inside here to see what is inside the uterus here. Is it a polyps or is it? So this can confirm what we saw on the ultrasound. So we can see whether we have polyp or we have a endometrial hyperplasia or we have a cancer. Then we can even take biopsy right at the place. If you do the NC, we cannot, we just do a blind procedure. So this is a gold standard of endometrial assessment. Nowadays, is the office procedure can be done in the doctor's office also. And then where the doctor can also thoroughly inspect the endometrial cavity and then also can take a biopsy, at the same time can treat the disease. So this is how you like, see? So when you do endometrial hysteroscope, so you can see something like this. We can see, this is just, you see normal, but right, this is how your endometrium look like. They put camera. So we have fibroid, see, we might have something like that. This is a polyp. Look at that, the people who have a scar in the uterus. Sometimes people who had a previous DNC many times, so they end up with having a scar. Look at that, Asherman syndrome, or some kind of unhealthy endometrium. Look at that very thick wall. And these are all disease of the endometrium, that can happen. So it can be actually seen through the hysteroscopy. Macam the scope on the you put in the to see the stomach. Also the same, but this is a scope, a camera that we put into the uterus. So this is just example. I show you the hysteroscope that we do. See one on my patient. This is also 44 years old lady who come with a heavy menstruation. So then we put the scope inside her uterus. And this is how the scope, you see. You can see like that. See the scope? So you see, look at that. See this thing? All this messy stuff here. Okay, this is a tumor. Okay, so we take a biopsy to this thing, and then it come out is a cancer of the uterus. See, 42 years old woman. Look at that. See? So you never know what is in your uterus until you come to see the doctor. So when you see the doctor, you see, we put a scope, we can see this, right? And itself. So it's okay, and then we take the biopsy. So this example, okay, the hysteroscope that we do underwater, actually, macam aquarium, right? Okay, and then this is another example of a patient. See, this is, look at that, also 44 years old, if I'm not mistaken. She very obese, she also have diabetes, and she also have a heavy menstruation. Yeah. So when we do a scope, so we saw the uterus something like this flaky, white stuff. Because the wall of the uterus is very thick. See, macam fluffy, like this, yeah. So this is actually an endometrial hyperplasia. So then we took a biopsy, yeah, from here, and then came back as an endometrial hyperplasia. Endometrial hyperplasia is a pre-cancer. So we don't treat, over time it can become a cancer. So they have a good news and bad news. The good news is that there's a two type. There's a type we call the simplex. They can be treated with the hormones. No need to remove the uterus. But there's another type they call complex, and that also got two types, whether they atypical or typical. Those the atypical one, can have a 30% risk of becoming a cancer. So usually we advise the woman to remove the uterus. See, this is how the uterus. This is the ostium we call it, and then this is what abnormality is here. So this is an example. This is another example of the hysteroscope. Also, this is also in the age woman 41 years old. Look at here. Inside here, you see, you got a big thing inside the uterus. Look at that. What is this? It's a fibroid, very big fibroid in the uterus. Look at that. Okay, so this is the one that causing her heavy bleeding in the uterus. Yeah. Okay, see, very big that she has, the fibroid. So this is an example. Okay, so what's the treatment of heavy menstruation? Okay, that is just now what I show you, all those polyps. But as I mentioned to you earlier, women after 40 are also prone to have a fibroid. Very common. I see women, yeah, after 40, they have a fibroid, which is, if last time smaller, by after 40, the fibroid begin to grow bigger, grow bigger, yeah, especially in the early or mid 40s. So it can also due to adenomyosis, also common at the age of 40 as well. So these are the things we need to look out in women after 40 when they come with abnormal uterine bleeding. It can be in the form of heavy menstruation, painful menstruation, or irregular menstruation. So these are most common one, yeah, endometrial polyp, endometrial hyperplasia, uterine fibroid, uterine adenomyosis. So these are something that we need to rule out. So depend, what's the treatment will depend on the cause of the bleeding. Yeah, okay, if it is polyps, then we have to remove the polyp. We send for HPE when we see what's the result like. It is a fibroid, and then we have to discuss with the patient and how do we treat fibroid. So we have to discuss whether the women want to keep the uterus, or uterus have to, if they don't want to get pregnant anymore, usually people after 40, they are not keen to have any more children. So usually we advise them to remove the uterus. But if they're keen to keep the uterus, we do myomectomy, mean we just remove the mass only, so that we keep the uterus. All right. So of course, if this adenomyosis, menomyosis, also it's a disease that there's no medical treatment can work. Usually we have to suggest for surgery. But there are situations sometimes they can be treated with medication, yeah, with the hormone. So that's all depend on the patient's what are their compliant like, yeah, whether they are the one can take medication or not, whether they can tolerate the medication or not, so medication, so it's not like without side effect, yeah. So these are the most common therapy, medical therapy for people for women after 40 who has heavy menstrual bleeding, but she doesn't have fibroid, she doesn't have adenomyosis, she doesn't have polyps. So she's just having abnormal uterine bleeding due to hormonal problem or dysfunctional problem of the uterus, which is very common as well. So then with this, we can treat her with the medical therapy, and then we can use the first line of treatment if you're after 40, if you no longer want to get any children. So we call it hormonal intrauterine system, or we call it Mirena. This is the most common treatment, the first line that we will offer the women, because it is convenient, and then it gives you long-term control of the bleeding. Yeah, it can last for 5 years. This is actually hormone, put inside the uterus here. This is inside here, got hormone, will deliver to the uterus, this area only, doesn't go to your blood, and treat endometrial hyperplasia. It also can treat a small polyp. It also can also treat all those thickening of the endometrium, and very effective. It reduces your menstrual blood loss by almost 50 to 70%. 70% loss, reduction in blood loss, can be up to 90% or so. Sometimes after 1 year, the women even have amenorrhea, no period, after 1 year of having Mirena. Okay, and Mirena, she's very good because it protects the uterus from endometrial cancer. It protects the uterus from uh, uh, even benign condition like polyps, yeah, from growing in the uterus. So usually I would suggest for people who on tamoxifen, yeah, breast cancer patient, before they on tamoxifen, usually we encourage them to put this one in first to protect the uterus. So these are the Mirena or IUCD is the first line treatment. But of course, there are other treatment as well, you know, which is much cheaper. Or some people doesn't like and they have a like kind of phobia or don't like to have a bad experience with IUCD previously, so they don't want to put IUCD. So then we can put them on this kind of this other drug, you know, like tranexamic acid, temporary during period. You can give them for 5 days, the first 3 times a day, and that will reduce menstrual blood loss as well to 30 to 50% to reduction of menstrual blood loss. That if it is only in the hormonal cause, yeah, not due to fibroid or due to malignancy or due to adenomyosis, it doesn't work. Okay, another one is like dipanggil NSAID or non-steroidal anti-inflammatory. So this one we give the people who also having pain during period, and this is something like Ponstan, yeah, Ponstan, naproxen, and this and that, yeah. So these are the thing, but sometimes using this for long term cause people gastritis, yeah, acute gastritis, gastric ulcer. So usually not for long term usage. So they have a limitation. And some people use oral contraceptive pill to regulate the people period. These are purely for, again, not for people who have fibroid. These are people who have doesn't have anything in uterus, everything normal, but they have abnormal bleeding because of dysfunctional problem. Okay, so we also use progestogen, but of all, this is the first line and the most common, most effective treatment to use. Yeah, okay. So these are how it look like. Just now I mentioned to you, if reduced menstrual blood loss can be up to 90%. Okay, by 1 year it can become a amenorrhea. So these are the things. It's a Nobel Prize. People who designed this long time ago, about for more than 10 years ago, you know, who received a Nobel Prize because after this come into the market, 50% women, I mean, who requiring removing of the uterus, there's a reduction 50% of it. Yeah. Okay, so because it's very effective, right? So this is just now I mentioned to you, the drug Ponstan is reduced menstrual blood loss also by 30 to 50%. Okay, and tranexamic acid. Okay, this is how it look like. So you know, so it most if you come very heavy bleeding, the first thing if you come accident emergency, the doctor will give you this first before they offer you other treatment. Of course, sometimes if everything you do, some uterus, even though they look normal, there's no fibroid, there's no polyp, no adenomyosis, but they're still bleeding despite taking medication. They call a failure to respond to medical therapy. Their uterus like that. Yeah, I mean that whatever you do, the uterus still cries. You know, still crying every day, still bleeding. So this kind of uterus usually already lost its function. So we have to do surgical therapy, and then we have to discuss with the woman. If you're up to 40, usually we advise them to just remove the uterus. Okay? So, or some people who are unable to use medical therapy because of side effect. And some people don't like side effect, gastric gastric ulcer, gastritis. You know, people somehow even end up kidney failure, kidney problems. So this kind of patient, you know, where medical therapy cannot be used or causing side effect, intolerable side effect, we also ask them to remove interest, go for surgical therapy. Or people who have significant anemia. If you bleed every month that cause severe anemia to the point that you need blood transfusion, and you're already after 40, so we also tell the patient to remove the uterus, to do surgical intervention. Or if the uterus have other causes, mean that they have fibroid, adenomyosis, hyperplasia, polyp. So this kind of situation means they have uterine pathology, something that already confirmed. So we also tell this patient, this kind of uterus, you know, better do surgical therapy. So this just show you example of the hysteroscopic resection. See, we can do operation through the hysteroscope. See, through the hole just now, you can do this. This example, you got a fibroid, just now you saw the fibroid big one. See, we remove it like this through the hysteroscope. Yeah, so we're using the electrical energy to cut the fibroid inside there to remove, to give the uterus empty canal, so look at that. These are nowadays, we are lucky to live in this generation that we can actually do this kind of operation, no need to open. Long time ago, everything have to open, big surgery and all, okay. So this is an example. See, I mentioned to you just now, nowadays we are living in the era where operation doesn't have to, we don't have to open the abdomen now. So we can also do operation through a small hole where I give you a very small scar, not so painful, faster recovery, less use of painkiller, and faster discharge from hospital, and a very minimal blood loss, of course, in the good hand, so must be a very good laparoscopist. So can do nowadays this kind of operation. No need, to me, in my opinion, no women should do open surgery unless they have a cancer cervix, cancer ovary, but even cancer uterus also can be done through laparoscopy. So everything can be done through laparoscopy, yeah, okay. So this is just an example to give you, to give you the idea how we do laparoscopy. This is a case of women. She's early 40s, she's only 42, but she, some people are very connected to their uterus, like very emotional, like they feel like without uterus, they feel like they are not women, they must have uterus, things like that. So these kind of people, we have to give, we give them option whether remove uterus or remove the fibroid. So they want to remove the fibroid only, so we still do. Okay, but of course we have to follow up this patient in case the fibroid can recur again, yeah. Okay, so this is how we do the operation. See, look at that. If we do laparoscopy, you see this kind of operation, usually people open the abdomen, but nowadays look at that, with this small little equipment, so we can like doing the operation with a chopstick like that. Okay, see, look at that. This is how we take out this fibroid. See, these are fibroid, so we're going to take out from the uterus. So this is how we do it. See, we open. Okay, and then after that, after we remove this one big chunk, the uterus here, the fibroid, and then we close back the uterus, and then you see on the other side. Oh, sorry. I want to show you this one, but then it doesn't work. Okay, it doesn't matter. So this is how we actually do the removal. This is the fibroid already removed. We actually take out from this knife, suck it outside, to outside the abdomen. So that's how it is being done. So this is how being done. You see the operation, the doctor standing like that, okay, the patient here, and then we are looking at the screen, to do the operation. So no longer cutting big operation, yeah. So you see this example, we even can do big uterus. Look at that, this big uterus, big fibroid, all these things, which is last time can have to open. Nowadays we can give people like this kind of scar. Just open 3 holes, we can remove such a big thing, all go through the vagina. Okay, see, look at that. So these are the things that nowadays that we can do. All right. Okay, so we almost come to the end. Okay, this is how, just to show you, that the slide, and this is how we do the operation. This is the uterus adenomyosis. So this lady, she's only 58, 49. So we tell her menopause is just around in the corner, so might as well just remove the uterus. So we remove the uterus and the ovary. Okay, so this, look at that. We have only these 2 equipment to do. It's a very gentle operation. We didn't touch anywhere else. It's only the pelvis. So this is how we do the operation. Okay, so that's about it. Is there any other question? I feel I will be very happy to answer. I hope it will be very beneficial to all of you to have the idea about, all this abnormal menstruation after 40. If you are in the age of that 40, please look into your menstruation and don't normalize your menstruation. Don't yes, because I'm menopause, so, or coming to menopause, or so that's it, or normal. This is something usual, something common. I don't need to see doctor. So don't normalize it. So that's a problem with people come late. Why people come late? Very big uterus like that? Because they come very late. Because why? They think, oh, it's normal to have this normal period, or I'm coming to menopause at the age of 40, so my hormone is imbalanced, so it's normal if I have abnormal period. So people, and then they come with the hemoglobin very low and this and that. So don't normalize your period. If your period abnormal, abnormal. Go and see a doctor.
Okay, thank you, Dr. Sharifah. Thanks for your lively sharing of all the video so that we can have a better picture actually what happened to us during all the treatments. Okay, now also thanks to our friends that are still with us. We are open for a Q&A section. You can just leave the questions here where we'll get Dr. Sharifah's help to reply all your. Okay, meanwhile, while we're waiting, also I start with my question first to Dr. Sharifah. How heavy menstrual bleeding affect our health actually?
Yeah, it affects health because you see your body volume, we have only 5 liter in our body. The whole body, everyone's got around 5 liter blood. So if we lost blood, like almost 1 liter every month, so you're losing blood, you're losing hemoglobin. So your whatever you take every day cannot catch up to your, the loss. So then you end up with anemia. Then we call it iron deficiency because blood got contain iron, so you lost iron. So you lost iron, so the blood, they need iron to carry the oxygen to your body. So when you have hemoglobin without iron, we call anemia. So your body cannot function very well because not enough oxygen. So that's why you feel very tired. You feel want to sleep all the time. Very what do you call that? Sometimes you got blackout so often. And another thing is that when you climb stairs or when you do little bit work, you feel very like cannot breathe. So shortness of breath, very tired easily, and then your heart pumping very fast. So to some people, when they are very bad iron deficiency, the heart, because the heart has been working very hard all the time to send the oxygen throughout the body because now not enough oxygen, right? The blood cannot carry enough oxygen. So then the heart have to pumping faster so that they can reach out. Meet the demand. So the heart very tired. So enough, the heart will become swollen, and they go into, we call it congestive heart failure. So it is something, and then this is a common thing happen. Your school children. Okay, this is talking about women of the 40. But the school children, like in the age of teenage, so they also having common like that. Initially the starting period, the period become very heavy. The first few years. So they also become like very tired in school, that kind of thing. So they also have similar problem, hormonal issue due to a lack, all this ovulation problem. Ovulation are not mature yet. When women after 40, the ovulation become dysfunctional again because of the lack of ovum and estrogen production and so on. So so they lost blood. So that's why it's important.
Okay. Understand. Okay, how about Dr. Sin's doctor talk about heavy menstruation? Some heavy menstruation with large blood clot, is it a sign that we should concern as well?
Yes, of course. Just now I mentioned. So how do you know that your period is heavy? Number one, if your period you change pad more than 2, okay, in a day, so consider heavy. If you if you soak pad, so you change little bit, no, that one cannot count. But you must like soak the whole pad and then you keep on changing it. 1 hour change. So that is heavy. Or if you have blood clot coming out, because and the blood clot mean heavy period. So for the fact it's so heavy, it clot inside the vagina. So it's called blood clot, or they for flooding. Because they're too fast, the flow is so fast, so they not enough time to clot, so they just flood. So this flooding. So these are the sign of heavy menstruation. I must. If you have this kind of sign, you have to see doctor. I have many of my patients. They come and see me. They're so pale, and they didn't know they're pale. So when you ask them, look, when we start asking them how's the period, they say, oh, my period, biasa, normal only. So when you ask, okay, do you have blood clot? Yes. You have clotting? Yes. So I say, how can you biasa? You so pale.
Okay, they don't realize because they thought the clot is like a normal.
Yeah,
Okay.
Some people think like, oh, I must have heavy period so that all my dirty blood come out from my body. So these are the myths. It is wrong concept. So so must be heavy. So if period less, or the thing not enough, dirty doesn't not clean enough yet. So must have heavy period to be normal to feel good. That is wrong. So many people come period very little, so come. Or because why they need to have heavy period. So actually there's no such thing dirty blood dirty body will come out and then come up from the from the uterus. You know, so there's no such thing. The blood in the uterus, the menstruation, is formed because of the hormonal changes in the uterus itself from the ovary in preparing uterus for pregnancy. So when pregnancy doesn't happen, the whole whatever the uterus, the ovary has, I mean the stimulate the uterus just now, preparing the uterus, whatever happened there, all break down, become a period. So if you're pregnant, so it doesn't become period because it's prepare the uterus actually for pregnancy. But I mean this is a normal thing, yeah. It's a normal physiology. So it's nothing dirty with it. Of course, when they come up with debris because there's a you know what they call that cell, the thickness, the wall, you know, which is like a carpet, you know, in the uterus. All these are, you know, they have to starting new every month. So whatever old one all break down. So you have all those sometimes debris, chocolate thing, and this and they are all wall of the endometrium. So nothing dirty, right? So it doesn't matter whether you have 2 days period, 3 days, 4 days period. You know, they're still within normal limit. But if you bleed more than usual, that is abnormal.
Okay, all right. Okay, there's some questions from the viewer. Okay, is it experience heavy period once if compared to usual, then need to see doctor immediately, or should we monitor until next period?
Yeah, I should wait for 2 period or 3 period. I should tell my patient, wait for second, you know, they must be, because you want to confirm one time period, one time heavy, sometimes can be because of food you take. Maybe your food contain, I told you just now, you take some herbs or whatever, you know, that can cause some your blood changes and so on, you know. So then maybe you have a heavy period for that moment, or depend on your work, you know, I mean your stress level for that month. Sometimes stress can cause a little period or can cause heavy period also. So you know, all these are issue, but of course it won't be very heavy. But if it's just something that you need to confirm, usually I ask them to wait another month or maybe 3. But then if you really heavy blood clot, I mean don't need to wait lah, you know. So actually just come, yeah, because that's very abnormal if you have blood clot too much.
Okay. Okay. There's another question from the floor is that how long can we take transamin? Maximum of 1 gram daily.
1 gram daily.
How long can we take transamin?
Take 5 days. 5 days. You should take for 5 days.
Okay, okay. Then next question from Aloha as well. What if heavy bleeding around 200 ml per cycle, but hemoglobin okay, though with dizziness symptom palpitation?
I mean, hemoglobin okay for now lah. Because they call it chronic anemia. Over the time, the hemoglobin, the iron will drop over time. It doesn't. It's so chronic. It might take years. It might take, but then you lost your iron. Then you realize that you become tired. Even though hemoglobin are just nice, but you still very like not perfect, like not your performance affected also. Mental performance, physical performance may not be tip top lah. Okay.
Because the productions and also the loss cannot compensate that fast.
So iron, iron is required in the blood, your red blood cell to carry oxygen from the lung to the rest of your system. So you've got less iron, so then less oxygen lah. The blood cell can take from your lung to the rest of your body and to the rest of your cell function. So their performance same like if you they'll give them less energy, less of course performance also affected, isn't it?
Yeah. Okay, another fraction is that if someone with large polyps or fibroid, can they feel or see a lump from outer skin layer?
I mean, the polyps in the uterus, usually in the uterus, polyps in the uterus, they cannot feel it. Unless they have a cervical polyp. Cervical polyp is in the vagina, which is in the cervix there, where they put the finger in, they can feel it. But if in the uterus, they cannot feel.
So when it is in the uterus, we should do a screening ultrasound.
Yeah, we do ultrasound, you know, to check. The doctor will do ultrasound, and then we can see through the ultrasound, yeah. Okay, yeah, but fibroid is different. Fibroid is the growth to the size, you know, beyond 10 weeks. We call it 10 weeks. Usually they already come out from the abdomen. We can see the fibroid.
Okay. Okay, another question from Aloha is that perimenopausal period. I have period twice a month. Anything to worry about?
Yeah, this is the thing lah. We shouldn't normalize it, you know. Okay, because I'm going to menopause, that's why so that's normal. So I think we have to see doctor first, let doctor confirm, then only you can say, okay, doctor said that because that everything is all right. I mean, there's doctor already check your endometrium, they already check your uterus, check your ovaries, check, do a pap smear, already perfect, no problem. So then, okay, then you can take it that, okay, because that you are menopausing or maybe because of, you're in the perimenopausal period. But even that also cannot be like two times, like prolonged. I mean, if you 2 times, but your cycle repeated in every 3 weeks, so you can get early on the month, end of the month, right? So things like that within 21 days. So it's still considered okay. But then if you're every 2 weeks, so then it's quite difficult, right? I mean, it affects quality of life. You have to keep wearing pad, so something like that. So you need to get treatment, So maybe medical treatment can work, in this kind of situation.
Okay.
You need to see doctor because the doctor can give you treatment so that, the whole idea is that to give you keep you dry. I mean, nobody wants to have period walking with pad, right?
Yeah, correct.
Yeah.
Okay, there will be also another myth regarding eating pineapple will induce heavy blood
Uh-huh.
flow. Is that true, doctor?
Oh, that's not true lah. You can take lah 1 gallon of pineapple juice, or 1 lorry of pineapple. Nothing will happen to your. In fact, you feel very healthy after that because you have a lot of vitamin C, so it's not going to hurt your uterus in any way.
Okay,
I love
probably.
pineapple. I love pineapple.
Uh,
So I used to take pineapple every period.
so no issue there lah. Okay,
Yeah.
so just clear off the myth. Okay, okay.
Yeah.
Okay. Now I probably last questions that doctor can answer is that how to prevent heavy menstruation before 40s. Actually, doctor can give some advice to those ladies that actually in 30s now.
How to prevent? It's not
Any
something about
ways?
thing that we can prevent. This thing is something happen. They are
Mm-mm.
not. There are no. I mean, there are risk factors. For example, for endometrial hyperplasia or endometrial cancer risk factor. So if you know there's a risk factor, then we can look at the risk factor and work on the risk factor. There's some risk factor we can preventable. Some risk factor are not preventable. Like for example, cancer of the uterus,
Uh,
endometrial cancer. Okay, so they have risk factor. One the risk factor is like obesity, and then
mm,
number two risk factor is that high carbohydrate diet, too much carbo. Okay,
mm-mm.
and then hypertension, and then what they call that? People who has a polycystic ovarian syndrome. Uh, sorry. So these are the people, or they have family history, of cancer in the family, breast, ovary, and uterus together. So these are the things that risk factor that we can look at. Of course, before 40, very important. See, most of people after 40, do you realize that, when they reach 40, they become fat? Do you realize that?
Yes.
People after
Yeah.
40, maybe they come, doctor, why I become fat in my tummy, I become fat in my butt. So these are issues people after 40 when become fat there, because your BMR, basic metabolic rate, actually reduced after 40. So then that's why we have a high
Chances.
storage when we eat. High storage, so it's stored in the stomach. When you have very thick abdominal wall, fat mass is high. That's when your hormonal imbalance happen, because the fat there, they can convert your hormone estrogen become male hormone there. So then disrupt your cycle. And the people who have fat in the stomach have a higher risk of endometrial cancer, and also endometrial hyperplasia, and as well as other cancers. So these are the danger. So maybe before 40, when you are young, now not only just waiting when we are 40. So all the time, we need to keep up into our healthy diets,
Healthy
that
lifestyle.
reduce carbohydrate, increase vegetable, increase our protein, reduce stress, sleep enough. So these are all important. Yeah. Okay. As you enter to 40.
Okay. Thanks, Dr. Sharifah, for tonight's sharings with us. And thanks again also for friends that stay with us. If you like our talks today, and do click a like and share out so that more people can benefit from it. And before I end, I would like to inform also next Wednesday we will have a talk by a physiotherapist to talk about knee pain. For more information, please check out our announcement for in your Facebook page. The right clinic, the right doctor, the right care, the right information, the right knowledge. No panic, stay at home, mask on. Thank you, Dr. Sharifah, for tonight.
Okay.
And good night, and good night, everyone.
Okay,
Hope to see you next one. Bye-bye.
Bye.
Bye, Dr.